Welcome, husband. It's so lovely to have you back. We value your information, but also I was like, I don't have an episode for Tuesday.
That's why you asked me. I know.
Like
That's why
who?
you texted me at work on Monday.
Yeah.
Oh, can we talk about this
Like
today?
shit. Who could I get to come on? I know.
Yeah.
Anyways, so we are recording in the basement. It's a little bit of a different setup. So I'm going to test this out because, as you all know, I cannot for the life of me get my camera to focus. I have these expensive cameras.
Why don't you take it to like a camera store?
No, Sean is going to come to the house and help me set up the studio properly.
Okay.
With like lighting.
You've had these cameras for like a year.
I know, but
like
when I used them previously, it was in focus.
Oh,
So
okay.
I don't know. I must have played with like the thing on the front, and Caroline was like, watch YouTube videos on how to autofocus. Like you can set it to be automatic. And I'm like, I don't understand. Like, I don't know how to
There's
work.
no step-by-step on there?
I don't understand cameras. Like I don't want any part of it. I just want it to work. But this seems legit. So I'm basically just recording the video with the program that I use virtually set up in the office, in the studio with our actual mics into the recording, like the little, what's it called? Portable recorder thing. So anywho, the biggest question that I have for you is, are you so impressed with my cooking in 2024?
Yeah, it's been pretty good so far. I mean, we're only 10 days in.
Except for the pork chops.
The pork chops. One, I don't like pork chops.
I know, but
so I don't know why you thought that was going to be impressive for me, but
okay, so you know how I don't like shrimp?
Yeah, but I don't make shrimp for you.
Okay, I know.
So it's
just the pork chops.
That's the difference.
In my mind, I was like, okay, I've tried shrimp. Like when we go out, I try it. And so
you've never tried shrimp.
Excuse me?
No, never.
On vacation in Mexico, they had the deep fried shrimp things. I ate them.
A deep fried, come on. It's not the same thing.
I know.
You can deep fry anything and you'll eat it.
But I'm just saying.
It's not going to taste terrible.
You're always like, I don't like pork chops. I don't like pork chops. They are so good. And so I was thinking like, maybe you just hadn't had it. Like
there's something about the taste of pork chop. And I'm fine eating like bacon or like ribs. I don't know what it is. But there's something about pork chops, and I don't know what exactly it is. I cannot stand the taste of pork chops. I can't like stand the smell of pork chops.
But that's so weird to me because I assumed it was a texture thing because the texture of pork chops are very like.
No, it's everything about it. I just don't like it.
And nothing happened to you in your lifetime that.
No.
That's so weird. Because like for me with shrimp, and remember the other day you were like, I was like, I had a traumatic experience with shrimp or something. And you were like, what happened? And we just kind of like stopped talking about it. Did I ever tell you?
I don't recall you ever. No.
Yeah. So anyways, when I was little, and this was when we lived in like, you know, where my old house was in Sudbury in Llewellyn, it was like across the road. Remember Mallard's Landing where you could see the ducks and stuff?
Yeah.
So it was in that neighborhood when we lived there. So I would have been kindergarten and senior kindergarten. Like that was my age. So like Milo's age.
Mm-hmm.
And at that time you could go to the grocery store and buy almost like a cardboard box thing, like a Timbit box almost of shrimp to like from the grocery store. I swear to God, I'm going to ask my mom if this is facts.
I don't remember ever in my lifetime seeing that.
I don't know if I made this up.
They came in a bag or you got them at like the counter and they put it in a bag.
This is what I remember from my childhood, and I'll ask my mom if this is actually what happened. I was carrying them into the house in the kitchen and the bottom of the box like let out.
Yeah.
And then there was just like disgusting shrimp like all over the floor on my feet and stuff. And that's the only thing I can think of that makes me so, and just like the way they look.
It's not even like the taste of it. But it's funny because you'll eat crab, like crab cakes.
Yeah.
Like lobster.
Yeah.
Like lobster is just a big shrimp, basically. Like in terms of like the taste and like the texture. True. But they have these, what did I see? I think it was at the grocery store, but I've seen this like online about this. There's these Argentinian shrimp, and apparently they taste like lobster more than shrimp.
I don't think
Um,
it's the taste of shrimp that irks me. It's like a
Hmm.
mental thing. Like they just look disgusting. And the fact that you like, I'm like have the shell in your hand.
no, but you
Like
can eat it. You can get it without the shell and just eat the shrimp.
even still though, it's like a little like turd. Like I don't know. It's like the way that it looks. Like
Okay.
I just don't like it. Anyways, okay. This is not the topic of the podcast, obviously. So let me open my notes. Yes, I have notes. Our dog, by the way, is just like walking around on the floor here. Bubbles, you want to come up? What are you guys doing? This is weird.
I'm going to town over there.
We usually watch TV right now. Yeah, we just put Milo to bed and he didn't go to bed last night till 11 p.m. So I assumed he was going to be exhausted because today was his first day back at school and then he had swimming lessons. And I'm like, he's got to fall asleep so we can record this. But
he just likes to fight it, though. I was up there for like 20 minutes and he was like, rub it back. No, don't do that. I'm like,
but also,
just calm down.
What I was concerned about was, you know, sometimes when you stay up really, really late, you're exhausted like all day. But then once it's nighttime again, it's almost like your body is used to being awake late.
I've never had that happen in my life.
Yeah, not you, because you fucking sleep all the time, no matter what. But anyways,
Look, I could sleep right now. So if we don't get this rolling, I might fall asleep here.
Okay.
I got home at 1 o'clock last night.
Oh gosh. Oh gosh. Bub and I were fast asleep.
Yeah.
Okay. I wanted to do a podcast episode for a long time about vasectomies and just male reproductive health in general, because I feel like every time I have posted something or talked about vasectomies, like there's so many comments and people always ask so many questions.
Yeah.
So even though this is the mom room and we usually talk about lady things, today is for the men. So you might want to send this episode to your husband, to your brother, your dad.
If they're contemplating getting a vasectomy or something like that.
Yeah, totally for show. So the first question, I thought of just some general questions today that maybe people might be interested in. What is the general scope of a urology practice? So what does a urologist do? And I feel like
I don't think you even know the answer to this question.
I kind of do. I can give you like my.
What's your what do you think a day in the life is?
No, but that's not the question.
Okay.
I feel like most people, if they're not in the medical field or they don't have friends and family that are in the medical field, they don't necessarily know what the different specialties do. Unless it's like, okay, ear, nose, throat. Okay, they do ear, nose, and throat stuff.
Yeah.
But especially when it comes to urology, because I think a lot of women, like we associate our care down there with gynecology. Mm-hmm. And then I think a lot of people assume that urology is strictly for men.
Yeah.
So let's I think
the old sort of adage is, it's like a male gynecologist, but it's definitely not. I mean, I would say 40% of my patients are women. And I mean, we just deal with an array of things. So, anything from kidney stones, cancers of the urinary tract, which can affect anyone. And so even specifically female things, stress incontinence, fistulas as well. So these are things that can happen.
What's a fistula?
So a fistula, I mean, in general terms, is a connection between two structures that are not normally connected. But for like in women in particular, like vesicovaginal fistula, so between the bladder and the vagina, sometimes can happen after certain gynecologic procedures or traumas.
They're connected?
Yeah. So like a hole develops and you kind of create a connection, and that connection becomes what we call epithelialized. So you get kind of a tract between. So if somebody's leaking constantly and they've had surgeries in the past or birth trauma, it's just something to rule out. But that's just one example of like a specifically female issue that urologists deal with. There's even like a subset of urologists who are female pelvic medicine specialists. So dealing with things like prolapse and incontinence.
Do you know any female?
Yeah.
Where?
There's one that was in Hamilton with me, or she's in Hamilton right now. Sorry, but we were in residence together. Laura, you met her a few times. Yeah. That's.
And so she specializes in that stuff.
Yeah,
Oh, that's so
that's
cool.
kind of her subspecialty.
I should have her on the podcast. I
Yeah.
feel like that would be a good one. Okay, so when it comes to reproductive, so if there's a couple, man and a woman, trying to have a baby and they're having trouble, the female would go do tests through gynecology, but the male would go to urology, correct?
Well, oftentimes, I mean, I can only speak for Ontario and kind of Canada in general, but oftentimes, if you're going through your family doctor, you can get those initial tests done through the family doctors. So for women, ultrasounds, blood work, that sort of thing. For men, even blood work as well, but semen analysis would be something that would be indicated, and at least you can get like a cursory workup there. And if patients go to fertility centers, often it's a multidisciplinary team. So gynecologists, reproductive medicine specialists, usually those are gynecologists, and infertility or male factor urologists. So looking at male factor infertility, right?
Yeah.
So I think the important thing is, especially with fertility, the general rule is, assess both partners, and then sort of go for whatever might be abnormal, right?
So what would you say are the top 3? Oh, my answer for about what urology, I was just going to say like bladders, everybody has a bladder. That's not like a specific to a man or a woman.
Mm-hmm.
Kidneys.
Yeah.
Like I think when people think urology, they don't necessarily think kidneys. Kidneys, bladder, prostate.
Well, women don't have prostates.
Yeah, but no, yeah. But that's what I'm saying. That's what I'm saying. Like this is what urologists would look at, and then urinary tract things. So like UTIs, like all that kind of stuff.
Yeah. So that's another kind of more, I shouldn't say specifically female, but predominantly female issue that we deal with is recurrent urinary tract infections, which, I would say probably 10% of my practice is, consults regarding that.
Yeah.
It's a challenging scenario because oftentimes you don't find a specific reason to tell people, this is what your problem is, this is how we can fix that. It's often a very multifactorial problem and sometimes just idiopathic. We don't really know what the specific reason is. And unfortunately, it's hard to tell someone that, and it's sometimes hard for that patient to accept that there's nothing specifically wrong that we can
but you can do like
right?
preventative.
Yeah, I mean, certainly we talk about prevention strategies. We also talk about sort of being more not necessarily prophylactic, but proactive when it comes to early treatment, and strategies around that. It oftentimes does require sort of early treatment with antibiotics, which, no one wants to be on antibiotics all the time. But if you can get early treatment in a few days of treatment rather than, progressing to more severe infections, it definitely is something that we can look at.
Okay. I have only had one really bad UTI in my entire life, like knock on wood. Like I'm just not somebody that gets UTIs.
Yeah.
And like my mom gets them really badly. I think my sister did as well, but that was like the worst night of my life. And I remember this was when I lived in Quebec, and I remember like I couldn't just, because I had an Ontario health card, I couldn't just go to the clinic down the street. Like I had to wait. Like it was a whole, my God, I was so irritated. But that I was like in the fetal position, rocking back and forth, like in pain, just like going to the bathroom, like peeing, like it was terrible. And then eventually got on antibiotics. But I remember talking to, it was obviously like a general physician when I went to get tested or whatever. Yeah. But he was saying like some people's bodies, like your internal things might just not jive with like your partner's internal things, and it can create like, is this facts? Have I asked you this before?
I mean, I guess everyone's kind of microbiome is a little bit different.
Yeah.
So that's one sort of theory behind, specifically intercourse related urinary tract infections. But I think a lot of research these days when it comes to prevention is looking at receptors in the bladder. And, if specific patients have higher concentrations of certain receptors, are they
receptors for like bacteria?
Exactly. Yeah. So bacterial adherence to the wall. Are they more likely to get bladder infections? So there are some treatments out there, some like D-mannose, cranberry. Those things kind of affect bacterial adherence to the bladder. And there's some newer products that have higher concentrations of those active ingredients that can sometimes further reduce the risk of infection. So it's more of a prophylactic type treatment.
If somebody gets recurrent, this is not the topic of this podcast, but
we're spending a lot of time not on the
literally
topic of this
welcome
podcast.
to my life. Like, this is what it's like to be in my brain. Okay. Like, here, let's sit down and talk about this. Yeah, exactly. Yeah. I just have one question and then we're going to move on to vasectomies. I swear to God, if you're a man listening to this, I swear. They're like, what the hell is this? The cranberry thing. Yeah. Do you recommend people, because I remember you saying like to drink the juice, like you would have to be drinking like
the concentration in the juice.
Because they make pills, right?
They have cranberry extract pills. Mm-hmm. There's some other kind of extract type pills that are out there. I'm not going to plug any products, but there's definitely some things on the market from some brands that have kind of higher concentration of these ingredients. But in terms of the juice, I mean, I think, I always have patients come in, I'm drinking like pure, like organic cranberry juice.
Have you ever tried that?
And I'm like, yeah, you're spending like $20 a bottle. Mm-hmm. Probably not going to do as much. But, anything is better than nothing if you're trying to be proactive.
Yeah. Okay. On to the topic of the freaking episode. At almost 20 minutes. Okay. So I'm just going to skip that question because it's not the freaking topic and it's going to veer me off into another direction. Okay. Let's walk through what a vasectomy actually is. And this is exciting for me because I have an idea, but like, I don't think I really know.
Idea?
My idea is that you have the two testicles, and I hope Sean clips this for a TikTok. You have two testicles and there's a tube that goes into each testicle.
Yeah.
And you are snipping the tube and tying it off.
So that is
each tube on each side.
Yeah. Okay. I mean, that's kind of the idea. So in terms of vasectomy, so the testicle is kind of like a soap on a rope. Okay. If you think about that, the rope would be something called the spermatic cord. So that has the vas, that has the blood vessels, that has some muscle tissue and some other structures. I won't go into them. That was a question on a Royal College exam, which was like 10 structures in the vas or in the spermatic cord. Anyway, so the vas it feels kind of like an al dente.
Okay, when you say vas, what is that?
The vas deferens.
That's
the tube that we're going to cut in a vasectomy.
Oh, okay.
Yeah.
Interesting. Vasectomy.
So it's kind of like, like in terms of texture, it's like an al dente spaghetti noodle. So you can kind of feel it. It's kind of firm, kind of that.
So,
same
and it
kind
goes
of size.
from like.
So it goes into a structure called the epididymis, which is where when the testicle makes sperm, the sperm goes into the epididymis to kind of mature, and then it comes through the vas and then into the ejaculate. Okay.
Oh, right. Okay. Because so the sperm is sitting in the testicle?
Yeah. When you make sperm in the testicle, it goes through some maturation, but it's not totally mature. It goes into the vas and then it completely matures. It becomes motile, so it moves. And then it can actually go into the reproductive kind of tract, right? Like when a man ejaculates.
Okay.
So the vas is kind of the one structure where it's a single tube. So it has only one channel that it can go down, right? So it's in the spermatic cord. And as I said, it's something that you can palpate. And it's certainly something that we can cut. And so that would interrupt the flow of sperm. And by doing that, you you have no sperm in the ejaculate.
I just have a question. Like, there's two testicles, but are you saying there's only like, so the tube meets totally, and then it's one?
The vas is separate, but when it like the sperm all go into the same place.
So are you cutting just one cut or two?
Two.
Okay. That's okay.
They meet inside the body.
That's what I was curious about.
So anyway, so in terms of the procedure itself, generally this is done under local anesthetic. So just we use a bit of an injection of lidocaine or Marcaine. These are local anesthetics that similar to what you'd have.
So is that painful for people? Because I have had freezing done to get moles taken off, and it is.
So it can be, and I mean, some people, depending on where you go, you can put on some topical anesthetic first, and then kind of inject afterwards. Like if you're taking your kid to get their shots, you kind of put that cream on their arm. Same sort of thing. You can do that. There's some other devices where it's kind of more of instead of a needle, it kind of like it's pressurized air that kind of pushes it in. So that's more of people call it less invasive, but I mean, it's not, it's the same thing.
It's just like, I think it's the liquid, because I remember the plastic surgeon explaining that to me. Like the liquid just stings when it's going in. Yeah.
It's just the ingredients in it that kind of burn. But once it's in and you don't feel anything. So in terms of the procedure itself, so there's various ways of doing it. The standard way these days is something called a no scalpel vasectomy. Honestly, it's more of a misnomer than anything else. When people think of no scalpel, they think, oh, you're not making a cut anywhere. You're just somehow doing this without any openings. It's basically a sharp forceps that kind of splits the skin open, and then you can get access to the
tube. Little like thing that goes like
this? Yeah, exactly. So instead of like cutting it, you're kind of
it's almost like little sharp pointy tweezers that
you spread the skin open.
Yeah, that seems worse to me.
Well, I mean,
but you can't feel anything.
You shouldn't feel anything.
But still,
you shouldn't feel that.
Like I would rather anyways.
Yeah. So there's different ways of doing it. Some people make an incision on both sides, so around the tube on either side. I typically make an incision just in the midline and pull the tube from either side through that one opening. It's just less holes.
That's interesting.
And then we basically expose the tube just itself, and then you have to do something to occlude or close down the clip, or close down the tube, I should say. So all the guidelines, like Canadian Urology Guidelines, American Urology Guidelines, recommend doing like a double ligation or cautery of the tube. So
what does ligation mean?
So tying it off, basically. Some people do suture. So basically the stitch that kind of ties it off. When I do these, I usually use small titanium clips that stay in there. So it's just the clip on either side, and I cut out a piece of the tube using cautery between the clips. Okay.
So so you make your one hole, you pull the tubes from each side.
Yep. Yeah.
And the tubes are connected at some point, right? Or no?
No.
Oh, okay. Yeah. So you're cutting, why don't you just cut the tube?
No, I do. You do.
Oh, okay.
You have to.
But you were saying some people just stitch it? That seems like if
No, they tie it off, and then you also take out a piece between. Right.
Oh.
Yeah. So that's what I mean by kind of double occlusion.
Oh, okay.
You can also kind of stitch over some tissue inside the scrotum over it to kind of close it further. I don't think you necessarily have to do that. It's just, people have different methods of doing it. But overall, the biggest thing you want to do is make sure it's occluded, so closed off on either side, and then cauterize sort of on the inside of the tube as well. So that kind of closes it down. Right?
So can you explain to me then, if somebody gets a vasectomy, where, in our little diagram of the testicles and where the sperm goes and stuff, is the tube not severed? How does semen still travel?
Well, the majority of this ejaculate volume is not sperm.
Is not from the testicles?
Yeah. The majority of it is from your prostate, or something called the seminal vesicles. It's like almost nothing. There's no change, no appreciable change in ejaculate volume after a vasectomy.
I feel like a dum-dum, but like, I wonder if other people are going to be like, what?
I've had that question before, for sure, in the office.
Interesting.
Yeah.
Okay. So let's get into some of the questions that people had about vasectomies. Oh, my notes keep closing. So the first one was about how common a failed vasectomy is. And like almost every question, well, a lot of questions were about failed vasectomies.
Okay.
So explain, first of all, how that even happens if you're literally severing it.
Yeah.
And then what's the occurrence? Like how often?
I think there's a couple of reasons. One, in patients who have a lot of tissue in the scrotum, like around the tube, sometimes you can pick up tissue that kind of looks like the tube once you like kind of grab it, things like that. But it's not actually the tube.
What does the tube look like? I'm picturing like a blue vein.
No, it's white.
Oh, okay.
Yeah. So like I said, it's kind of like spaghetti.
Oh, literally.
Yeah, but just firmer. So sometimes you can pick up something that kind of looks like the tube, but once you cut it, it actually isn't. So if you don't recognize that, sometimes you can cut the wrong thing. And you think it's a tube, but it wasn't, and you actually didn't do a vasectomy on one side or the other. The way you kind of confirm that was what I do is to send off the piece of the tube on either side to pathology, and they'll tell you that was the tube because it obviously looks like there's a characteristic pathologic.
But that's not like a standard practice.
I think most people do it. Some people don't. And some people just send both pieces together as one specimen. I like to send it separately so that if you do get a piece that says, oh, that wasn't the tube, you know which side it is. So that, if you need to do it again, at least potentially you can only have to do one side.
Yeah.
But so that's one potential reason for why the vasectomy fails is because it wasn't actually done properly. The other thing that can happen is if you don't take enough of the tube, once people heal, if there wasn't enough occlusion of the tube or the clip falls off or something, once things heal, the body has a tendency to kind of recanalate things. So the sperm is still being produced, it's kind of pushing its way out. You get inflammation and the tube kind of draws itself closer together. It's kind of like, the analogy in it's not a direct analogy, but like if somebody had their spinal cord severed, you're going to get some regrowth of things, and like how do the nerves kind of know where to go, right?
That's crazy. That's like science fiction.
But
stuff.
That's more of a rare kind of reason for it. But in terms of the rate, I was looking this up. Actually, it's like 1 to 2 per 1,000. So less than 1%. Less than 0.1%.
Yeah. And so is it standard practice? Does everybody, because a lot of people were saying like, my husband got a vasectomy, but he never went and did the follow-up test. Like,
I always tell patients that doing the testing afterwards, the semen analysis, is as important as getting the test done, getting the procedure done.
Yeah.
Because if you don't do the test, how are you supposed to know if this is actually effective?
Yeah.
I've actually had a couple of people say, I'm not going to do it because if it didn't work, then this is like God's plan. But yeah.
Okay, Drake.
But yeah, so I mean, that's the most important thing. And most people will get you to do at least one semen analysis test. I used to do it once at 6 weeks and then another one at 3 months. But I found people would do one or the other. They would do both because it's kind of cumbersome.
Yeah.
So I've switched over to just doing it every 3 months, like at 3 months. And then if that's fine, then you don't have to worry about it.
How common are adverse outcomes of, so like, every procedure that you get done, they're like, there's the risks involved and blah, blah, blah.
So, I mean, the spiel I give people when I talk to them about a vasectomy and the potential risks. So like any other procedure, bleeding, so bleeding from the incision. If it's in the scrotum, then you can because it's a bag that has no pressure, you can get a collection of blood called a hematoma that can
Mm.
sometimes form. Obviously, infection is.
So you mean like abnormal bleeding? Like,
Yeah.
okay.
Yeah. Infection is one potential risk. The risk of infection with vasectomy is extremely low. We don't generally even give patients antibiotics beforehand. Certain patients, obviously, if they're, if they are predisposed to infections, if they're on immune suppressive medications and things like that, we'll give them antibiotics usually just right before the procedure. Some people go home with it in that scenario. Other risks. So, obviously failure is one.
Mm-hmm.
Injury to other structures. Obviously you're dealing with the spermatic cord. You're trying to isolate the vas on its own. I've never actually seen this happen, but I've heard in one specific instance where the artery to the testicle was cut and not along with the vas. And so there was no blood flow to the testicle and the testicle was lost.
R.I.P.
Yeah. So I mean those are
like
extremely
extreme,
rare
yeah.
complications of the procedure itself. In terms of like secondary effects of the vasectomy, so chronic pain in the testicle can sometimes occur. There's various kind of reasons for that or pathology behind it. If you're injuring nerves that are in the spermatic cord, inflammation in the cord can sometimes compress some structures and nerves that cause pain in the testicle. Because the tube is cut, your testicles are still making sperm, and if they don't have anywhere to go, sometimes it can create a bit of a blowout of the epididymis where they're normally maturing. That can cause pain in the testicle. But again, these are rare instances.
And so if that were to happen, are there
it's usually
treatment things or?
Initial treatment is just supportive care. So anti-inflammatories, pain medications, that usually controls things in the vast majority of people. For patients who have chronic pain, like that's probably 1 to 2% of those patients who have this issue. You can do things like cord blocks, so putting freezing in the spermatic cord to control it. You can do something called a cord denervation, so cutting the nerves in the spermatic cord. There's usually a microsurgical procedure that to do that, and that can reduce any sensation in the testicle. Reversing the vasectomy can sometimes improve things because you reestablish that's flow of sperm, so you don't get that buildup. And obviously other kind of more drastic things, like even taking out the testicle. But again, that's very rare that would happen. But it does on occasion. I say this, not to scare anyone. The risks involved with the vasectomy are much lower than the vast majority of surgical procedures. Certainly much lower than a tubal that a woman would get if they were going to do it. And it's just something, just like any other procedure, there's always, you have to weigh your pros and cons, right?
So why, if obviously a vasectomy is like a method of just like preventing pregnancy, right? Yep. But why do we only do a vasectomy? Like, why don't you just get rid of the sperm?
Well, what do you mean?
Well, I don't know. Because you're like, if you have a vasectomy, some of the adverse, like one of the possible things would be like the sperm are still being created and blah, blah, blah. It's like, just
but
get the fuck out.
Like, there's no real way to do that. You can't really selectively have your testicles stop making sperm, but not stop making hormones. Like testicles make testosterone.
Okay.
Yeah.
Gotcha.
If there was a way to do that, if there was like a male birth control, then that would be effective.
It would be like Bubbles.
Yeah. Bubbles had his testicles removed.
That's what I'm saying, though.
Yeah.
Poor little bub.
Yeah.
Okay. Bubbles is my dog, by the way. So that leads me to the next question, which was, does a vasectomy affect testosterone?
No.
Okay. So many people had that question, and I was like, that's interesting. A lot of people must think that.
No, I mean, you're interrupting sperm flow. You're not interrupting the production of testosterone in the testicles.
Yeah.
And it's going to drain into the bloodstream. So there's not going to be any effect there.
Does reversing a vasectomy always work?
No.
Ooh.
So when it comes to vasectomy reversal, the things I counsel patients on, in terms of effectiveness, 60 to 80% when it comes to reversal. A reversal is generally a much longer procedure. Takes a couple of hours generally to do.
In the OR?
Not in the operating room. Yeah. Most people, if you're going to do it in the operating, will do it with a microscope, because the tube that you're sewing is so tiny. Like the stitches that we use to do that, you can hardly even see. It's like a hair. Yeah. So it is a microsurgical procedure. It does take kind of more of a subspecialized urologist to do it. I mean, certainly there are some community urologists that do it, but it's a very nitpicky type procedure. It's not something that I enjoy.
I would hate that. Yeah. Like, ugh.
And there are certainly factors that can impact the effectiveness. So, how long it's been since your vasectomy. If it's been more than 10 to 15 years, the success rates are much lower. The length of the defect, so how much of the tube is taken out, can certainly be a problem. And if it's too long, sometimes you have to do other maneuvers to kind of try and make it work, whether that's getting some more length in the testicle, or even getting the vas into the epididymis instead of the tube itself. So there's definitely things to look at, or things to take into account there. The other thing, in Ontario specifically, and I think in most provinces in Canada, except for Quebec, I believe, it's not covered by OHIP. It's not covered by insurance. And so it's kind of the Wild West out there in
How
terms
much
of
does
like,
it cost?
Yeah. So, I mean, some people charge like 2,000 to 3,000. Some people charge like 6,000 for reversal. So it's very variable. And again, that's to have the surgery done. There's no guarantee that
it's going to work.
For 6,000, you're getting the surgery, but it doesn't mean for 6,000 that it's successful. Okay. So it is something to think about.
My question is, let's say somebody gets a vasectomy and then like 5 years later, they want to get it reversed, doesn't work.
Yeah.
Are they just like shit out of luck? They can't ever have a kid, or can you like take the sperm out of the testicle and like do IVF?
Sure. Yeah.
Oh, okay, cool.
I mean, like I said, the testicles are still making sperm,
but they're not maturing, you said.
But they're generally not mature, right? So, but you can still use immature sperm for assisted reproductive techniques.
Oh, interesting.
So things like IVF, something called ICSI, which is a different type of assisted reproductive technique. They don't necessarily rely on the sperm being able to kind of penetrate the egg, because you're kind of doing that artificially, right?
What is the aftercare / recovery of a vasectomy? Like, what can people expect?
You should be waited on hand and foot.
No, this is a lie.
No, I mean, it's an outpatient procedure under local anesthesia.
Yeah.
I mean, I would equate it to...
It's like getting a cavity. Okay, so everybody calm down.
I mean, it's a cavity in your balls. It's a little more sensitive.
Yeah, but...
But yeah, I mean, it's taking it easy for a day or two. And when I tell people take it easy, I mean, don't just sit on the couch. You can, walk around. You can do things like that. Not too much heavy lifting. Any kind of strenuous activity like that can certainly cause more discomfort. Lifting heavy, have your kids jump on you or something like that, it's obviously a risk to creating more discomfort. Icing is very important afterwards. So will help with the swelling, reducing your discomfort. A bag of frozen peas is what I tell people. Like a bag of frozen peas will be your friend for 48 hours after the procedure. So usually wrapped in a towel, like a dishcloth on the scrotum. What else? That it's really just supportive care. It's not.
Do you prescribe medication?
Not usually.
Because so many people are like, well, we hear things all the time about like.
I mean, I usually put in a longer acting local anesthetic, something called Marcaine, which usually lasts like 4 to 6 hours after the procedure.
Yeah.
And And so you're anesthetized 4 to 6 hours, but then afterwards it can also help the pain control, and that for like a day or two after. Tylenol, Advil, naproxen, those types of things are generally sufficient. You get the odd patient who will call the office like the next day saying their like pain is under control. So you have to give them something a bit stronger. But I mean, it's just like anything else. Like everyone's pain tolerance is a little bit different. But I think, if you're giving people prescription pain medication after vasectomy, I think it's probably overkill. Like, I don't think someone needs a narcotic pain medication after a vasectomy.
Remember after I gave birth, how long after was it when I had that welt and I had to go back into the hospital?
A couple weeks, probably.
No.
Yeah.
I thought it was like within the first week.
No.
Anyways, I was still like in so much pain from giving birth. And then I remember when I had a welt in my nether regions because I'm just a lucky gal. And so that was the first time I had to leave Milo because I had to go to the hospital, and the general surgeon there had to drain this like welt on it was like in between my crotch and my butt. And she was like, "Oh, you poor girl, like you just gave birth and now you're back here with like a welt." I was probably from like wearing diapers or like who knows, right? And anyways, she froze me, obviously, to do that. And I remember driving home being like, oh my God, I feel incredible. Because like everything was frozen down there. So that's my story.
So very, very similar. I mean, the other thing I tell patients, and I think it's very important to know, even though we're doing it under local, you never know how you're going to react to getting this procedure done. Like people, like you see guys who have full arm tattoos and stuff, they come in and they're like passing out during the procedure. So always have someone drop you off, pick you up, because you never know. You never know how you're going to feel. So
I was just going to say a super bad reference, but
what's the super bad reference?
I don't want to be canceled. Pussies on the pavement, fellas.
You're going to get canceled for that.
I don't care. Yeah. Okay, let's answer this question and clip it for the tiki-taki. Is getting a vasectomy a lower health risk than a woman getting her tubes tied?
I mean, in terms of the procedure itself, definitely. I mean, this is something we can do in the office. It literally takes 5 minutes. And the recovery time is a day or two. For women to get a tubal ligation, I mean, generally these days, it's usually done with a laparoscopic procedure if it's like a standalone procedure. Some people, like if they're getting a C-section, will get a tubal ligation at the same time. Or if they're getting other procedures done for other reasons, they can sometimes get that done. But if it's strictly a procedure, like you only want the tubal ligation done, it's usually laparoscopic, which, I mean, that carries other potential risks: bleeding, injury to other structures in your abdomen and your pelvis. So certainly higher risk overall. It's a general anesthetic or a spinal anesthetic usually. So it's completely different animals when it comes to the procedures.
And honestly, like if you have had kids, like she's gone through enough. Go get your fucking vasectomy. Like, give me a break.
Yeah.
And I feel like people are asking that question because I put up a question box on Instagram and I'm just reading some of the questions that I got. Yeah. And that came up like quite a few times. And I'm sure it's because their husband is like, just get your tubes tied. Like,
I think, a lot of the time when I do consults for patients who want a vasectomy, it's, oh, my wife told me to come in. Like, that's not an uncommon thing. But then at the same time, you also get a lot of people who are like, my wife went through a lot with their pregnancy or delivery, whatever. Yeah. And, this is the least I could do. So, I mean, I don't think you can pigeonhole like an entire group of individuals.
Me?
Yeah.
What do you mean?
I'm not. Get your...
No. I'm saying for the people that ask that question.
Yeah.
I'm not saying all men are Clearly not, because the wait times to get a vasectomy are huge.
Yeah,
So I know most men are getting
Yeah.
vasectomies. I think it's very common to get a vasectomy, but I know that there's a handful of people that are like, get your tubes tied. I don't want to go and get my little
but these people are just assholes.
But that's
those
are the people that see my content.
But those are personalities. Like that's a personality problem. That's not a common thing.
Pussies on the pavement, fellas. I wish I could just like quote and reference Superbad all day, every day, but I'm due to watch it.
If you reference it enough, you might have to pay more royalty.
No, probably, literally. Just quickly, does a vasectomy affect libido? Is there an increased risk of cancer? A few people asked that question too about the cancer. I don't know where this is coming from.
I'll be honest. I looked into that because it's not something that you look into a lot. But there's no data to suggest either of those things.
Yeah.
So I mean, I wouldn't be concerned about that at all.
Why are there such long wait times? And again, we're in Canada for getting a vasectomy.
I mean, I think one of the issues is that there are some areas where people aren't doing it. Like we moved recently, and our group doesn't do it.
Really?
There's one guy who's kind of semi-retired that does some of them. But the reason we don't is because we work at a hospital with some religious affiliations, and it's not something you can do there. Some people choose not to do it because it's just not a high, like you can do a high volume, but it doesn't pay very well when it comes to doing vasectomies. At the same time, I think when it comes to, and I'm speaking specifically for Ontario, for in Canada, people don't, like, you see your family doctor and they don't really know who to refer to. Mm-hmm. Like there's no like centralized wait list for a vasectomy or any surgical procedure really. So you don't really know who to refer to. So you get one person who's got like a huge wait list and other people who can get you in a couple of weeks, right?
And you do need a referral?
In Canada. Yeah.
Yeah, in the US it's different, right? Like you can just call up a clinic and be like, hey, I can kind of get a vasectomy.
Well, I shouldn't say that. In Ontario, you can get a referral to a urologist that does it. There's some family doctors that actually do vasectomies in their clinics as well. I was going to ask that, yeah. And there's also these clinics around that strictly do things like vasectomy and circumcisions, that sort of thing. It's kind of a mix. I mean, I think some of them, from what I recall when I looked at it before, there were some that had family doctors, some that have a urologist that are kind of semi-retired that work there. So those are kind of just like assembly lines when it comes to these procedures. So they usually can see you relatively quickly. Obviously you have to go kind of a bigger center to do those. There's not a ton of them around. I mean, if you're in Southern Ontario like we are, there's a ton of these clinics around. But if you're like in Northern Ontario, there isn't really an option. And yeah, but I mean, you kind of have to go where you feel comfortable, right?
Somebody, like, because you mentioned the circumcision, I know some people had questions from when I put it up on Instagram about circumcision. Go listen to episode 51.
This is about neonatal, like kids
pediatric. Yeah. We have a whole episode on pediatric urology, which is very good. I'm going to link it in my stories maybe next week too. I'll link like all the episodes that we've done. But yeah, highly recommend listening to that one. Faux show. Okay, the other questions I'm not going to get into. I think we should save it for another full episode to talk about like reproductive health, because I want to talk about a bunch of things like erectile dysfunction. Somebody asked about that. Mm-hmm. I wanted to tell you about when I was watching, and just like that, the Sex and the City reboot. So, one of the ladies was intimate with a man that had a penis pump, and I wanted to talk to you about that. Like, I want to know what it is, and like he actually like pulled it out.
Like so You mean a pump or an implant?
Pump.
Totally different thing. Oh, okay.
He like took out this like little device to pump.
Oh, okay.
Before they
That's
were.
not really something I prescribed very often.
I know, but I'm just saying, like, it was an interesting thing, and I was like, oh.
I thought you meant like an implant, which is a totally different.
Yeah, like let's talk about that. Like, so let's do another episode where we talk about like erectile dysfunction. I want to talk about testosterone and like when people, I was going to say supplement with testosterone. Is that like how you would say it? Supplement or like take testosterone?
Yeah.
Like what that does, things that negatively affect male reproductive health. Yeah, all that kind of stuff. So I think that could be like an episode in and of itself. So we will save those topics because I do want to talk about them. Anyways, that's it for today. I hope you guys enjoyed, and Liquid Death can sponsor the podcast and send me some cases of your water so I don't have to drive to Buffalo.
Yeah. I'm sure in Niagara Falls somewhere they have it.
Reese was saying that there's like random stores or like gas stations where you'll walk in and they have Liquid Death, but I think he said cases, but I was like, I'm not driving around the GTA looking for cases of Liquid Death.
Oh,
like,
here.
Yeah.
Oh.
They sell Liquid Death here.
Well, I'm sure anybody can go buy this in the States and then resell it here. It's got a barcode, right?
Oh, I should set up a little shop.
I mean, that's how a lot of these convenience stores and stuff sell stuff.
Yeah. Also, people were saying that Summerhill Market sells Spindrift. Because, like, guys, literally, we went to Buffalo and, like, half of my cart at Target was water. Sparkling water.
I went to Phoenix.
And water.
I went to Phoenix and put a case in my suitcase.
Of Spindrift. Because every time I go to LA, I get Spindrift from Trader Joe's and I like savor it in my hotel room and I just love it so much.
But we got it from Target this time and it was like $1 cheaper.
It was much cheaper at Target. Yeah, for sure. That's why when people messaged me and they were like, oh, they sell Spindrift at Summerhill Market in Toronto. I'm like, oh God, it's probably like $10 a can. Like,
yeah, because you have to go all the way to Target to go get it.
No, Summerhill Market.
No, but I mean, they have to go. Where are they getting it from?
Oh, yeah, I don't know. Yeah. Anyways.
If they could import it into Canada and sell it, wouldn't they be selling it at every store?
You would think so because, like, I'm not going to lie. I don't like sparkling water at all. Like, I'm not a fan of carbonation. But the Spindrift has real fruit juice in it. And they have all different flavors. Clearly, it's really popular in the States. They have so many flavors. But, like, you can't find it here.
If you don't get a Spindrift or Liquid Death sponsorship after that.
Yeah. And I discovered Liquid Death also when I went to LA because the recording studio that I use there, they have a fridge stocked of Liquid Death, which is like so smart because I'm sure Liquid Death sends them cases because every time people podcast.
And now you have people driving 2 hours to go get it because they drank it one time.
Yeah, because they drank it one time. And I was like, oh my God, water in a can from a mountain? Like, give it to me.
It's probably from a tap somewhere.
Oh my God. Anyways, okay, well, this has been lovely. Hopefully the video and the audio works out. I think it actually will. This is lovely. I'm going to do this all the time.
Can I go to bed now?
Yeah. So it's what, guys, it's 20 to 10 on Wednesday. And this episode will be out next Tuesday. But normally we would be upstairs. I would be heading to bed right now to read my Kindle. And yeah. So thanks for hanging out, Bub. It's been a real slice.
I feel like Bub was mischievous and did something over there.
He probably peed on my fucking wedding dress that is over there.
Oh, he was like
trying to make a bed in it.
Yeah.
Honestly, does somebody need a wedding dress? Like, just DM me because this thing is like taking up space in my closet. Then I move it down into the basement, and then your mom put it in my studio, like on the chair, because I just threw it on the couch. I'm like, I don't know where to put this thing. Like, I don't want it. It was expensive. Like,
you're just hanging up in the.
And do what? So that I can throw it out in 10 years? Why don't I donate it to someone that doesn't have money to buy a wedding dress? I'm like, here is this beautiful dress. Okay, well, this was fun. You should come on more often. And then we actually sit down here and talk when Milo's sleeping.
Yeah. When he ever goes to bed on time. Like, this is.
Hey, he's pretty good.
Yeah.
He's had some moments. But anyways.
Recently. Yeah.
Do you see, though, how we held the boundary today for swimming lessons and he went? when Tanya was here, Tanya Kotler, we were talking about boundaries and gentle parenting. I don't think anyone knows
that he didn't want to go to swimming.
No, nobody knows, but they will know when they listen to this. He didn't want to go to swimming today. And my conversation that I had with Tanya when she was over here, and I don't know if it was on the podcast or if it was just like us talking. I was asking, like, I don't understand, like, holding a boundary. And I gave her the example of like, a kid doesn't want to put on their winter coat, but it's like -30 outside. And they're just like, no, like, because Milo's at an age now where he'll just be like, no, I'm not going. Like, I don't want to go. I'm not going. And like, won't come near us, like tries to run away if we like go to get him. So today I was like, you are going to swimming. Like, it's a safety issue for me. It's not even like, oh, you don't want to go do this like activity. Like, no, it's like a safety thing. Like, he needs to take swimming lessons. And I remember Tanya saying to me, like, sometimes you physically have to just calmly, like, you're very calm. Like, this is just, I'm holding a boundary. Like, I'm not freaking out. Physically get their coat on them. Physically bring them into the car. Like, he wasn't wearing his boots. He didn't have his coat on because he wouldn't put them on. He was like kicking his feet to get his boots on. I'm like, put him in the car without his boots. Like, I don't give a shit. He is going to swimming. And then he went to swimming, had a great time, did his swimming lessons because we just were.
It took him about 10 minutes before he actually went to the pool.
But still, whatever. We held the boundary and we fucking won.
Yeah.
Oh my gosh. Anyways, okay. Thank you guys so much for listening. Thank you for coming into my little dungeon. And I know he's so cute on camera. Like, so cute. Oh. Okay. Well, thanks. Bye. And I'm on a roll.